In this video, we're going to review using AI to help write a progress note. Just to provide a better example, I changed the diagnosis from the previous two cases to lumbar radiculopathy. But in the video, we'll discuss changing the diagnosis based on the changing signs and symptoms of the patient. The patient Brett initially presented with signs and symptoms consistent with lumbar radiculopathy, supporting this diagnosis with back pain with shooting pain down the right leg. However, since starting physical therapy, Brett's radicular symptoms have improved and are now centralized to his low back. For this reason, his diagnosis is being changed from lumbar radiculopathy to nonspecific low back pain. I'm just going to update my diagnosis. Brett presents with a diagnosis of low back pain and mobility deficits. Supporting this diagnosis is the localization of low back pain to the lumbar region and loss of range of motion in multiple directions. Symptoms are worse on the right side. Initially, when Brett started physical therapy, he could not lift more than 20 pounds from the floor. Now Brett can lift up to 30 pounds from the floor, however, cannot lift more than 30 pounds. Brett reports about a 50% improvement holding his child. Continues to be avoidant of higher impact activities such as hiking. Reports about a 50% improvement with twisting motions. He feels better getting in and out of his car. However, if he twists with anything with weight, like moving groceries, he reports continuing to feel pain and limitations. Initially, when Brett started physical therapy, he had increased pain the first hour of the day. Now the pain lasts about 30 minutes in the morning. This still interferes with Brett's ability to get ready for work. Medical history is relevant for high blood pressure. There's no other complicating factors that might affect the plan of care. And then for the objective measures, I usually go back to my last daily notes. We'll go back to my last daily note by importing it here so I can see what our measurements are. And then just making the changes. So let's say this improves. The lumbar flexion improved from 30 to 40 degrees. Lumbar extension improved from 15 to 25 degrees. Right lumbar rotation improved from 10 to 15 degrees. Left lumbar rotation improved from 15 to 20. Right lumbar side bending improved from 10 to 15 degrees. Left lumbar side bending improved from 15 to 20 degrees. And then let's say we're going to make some changes to the outcome measure. So the modified Oswestry OSWESTRY low back pain disability index improved from 53% disability to 41% disability. Myotomes, dermatomes, reflexes are still normal. Lumbar extension strength improved from 4 to 4 plus out of 5. Plan of care is still 2 times a week for a period of 12 weeks. Treatment will include therapeutic exercise, therapeutic activity, neuromuscular re-ed, manual therapy, patient education, and self-care. Today's session, we did therapeutic exercise, we did lumbar extension stretching, we did lumbar rotation stretching bilaterally, neuromuscular re-ed, we did resisted pelvic tilts with trunk flexion, we did lumbar rotation, contract, relax, PNF. Manual therapy, we did graded lumbar mobilizations, we did hip internal and external rotation mobilizations and prone. Therapeutic activity, we did hip hinging working up to 35 pounds. We did loaded twisting to improve Brett's ability to rotate. We worked up to 30 pounds at the cable column. We worked on lifting floor to waist. We worked on abilities to lift Brett's child. And then I just hit stop. Once it's complete, I hit comprehend. Writes all of this for you. It changes the goals. So I just add independent with home exercise program as the first one, and then the other goals here. So I can give like an overall progress for the goals and make comments if needed. And then now I'm on to my daily note section of the progress note. So just switch over my template to daily note 1. And then comprehend. I usually delete these boxes. Still thinking for this box. So another way, if you want to just get the objective measure box, I would go here. I like the objective findings one because it's nice to have that carry over from note to note. I'm going to check to see my billing. So the last part too is just making sure everything is correct or in the correct box. And that's all.